We are at a pivotal moment in our country where Trump and his cronies continue to move towards dismantling the Affordable Care Act. And we know that Covered California has done a great job of helping us get to our lowest number of uninsured. But if we're truly going to get to health care for every Californian, that means we have to invest in universal health care for all, once and for all. Trump and his cronies do not get to pick the health care winners and losers in our country, especially not in California. Just like we are protecting ourselves with our religious freedom, just as we are protecting our immigrants, just as we are protecting our most vulnerable against this horrible administration, we are going to protect the health care of every Californian, whether he likes it or not. You know, 2 years ago, I embarked on what somebody told me was this crazy journey of ensuring that we protected our most vulnerable, our undocumented citizens from obtaining health care. And people said I couldn't do it. People said this was just a statement piece of legislation. But you know, I'm grateful that now, because of our efforts, over 185,000 undocumented children now have full scope Medi-Cal here in California. We have done this together. We have demonstrated time and time again that California cares for all of its residents. That California cares for our most vulnerable, our children. But you know, going up and down the state, meeting these children that now have health care, they've asked me some important questions. Questions that have forced me to really think about how we get to universal health care. You know, many of the children were very grateful that now they get to see a doctor. That their mom doesn't get to choose between the child that is a U.S. citizen and the child that is a legal resident or an undocumented child. They've asked me, what about my grandma? What about my mom? What about my dad? When are they going to have access to health care? And so, as I pondered this question, we were moving towards a solution, but then Mr. Trump happened. Just like that, honey. I mean, trust me. I'm there right with you. You know, we have always said that healthcare is a human right. And nowhere is that more true than here in California, where we continue to expand services for our most vulnerable. Everyone gets health care, regardless of their status, and each one of them gets to select their own doctor. We're going to finally put doctors, nurses, and clinicians actually in charge of the care and not insurance companies. We're going to seek to control these outrageous pharmaceutical prices for our medication. And we're going to have a better quality of care for every single Californian. You know, my experience for Health for All and that fight we undertook, I know that our colleagues are a bit skeptical, but we're going to continue to work. And with your help, we're going to help convince them that this is the only way we're going to get to a healthy California.
I'm so thrilled to be here with my colleague, and we have some other colleagues who are here in support of this, but Ricardo Lara knows how to get it done, doesn't he? I am honored to be here with you today, and let me tell you, is there a nurse or two here? You know, my sister is a nurse, my mother-in-law is a nurse, so I know when I am in the trenches who I want with me. I want you. And we We are going to get this done. Let me tell you. You know, he talks about his story of immigration, and as I told one of my colleagues over here, I immigrated from Southwest Virginia. And there are some similarities. With all due respect, I will tell you. You know what I'm saying? So, when I was growing up, my dad, as Ricardo Lara said, was a coal miner and a construction worker. My mom was a seamstress. They worked harder than anybody I've ever met in my life. And yet we didn't have health care. We went to free clinics. You know, my dad was a coal miner. That's not a very safe job. We didn't have access to health care. And when I was age 11, I ended up in the hospital. They didn't know what was wrong with me. I had swollen glands, IVs, didn't know. My parents also didn't have paid sick time. And so one of them had to sit with me and miss work and not be paid because they weren't going to leave their child alone. And they didn't know, and it took about a week. And think about a hospital stay for a week. I mean, it was 40 years ago, or 50, but who's counting? It was still a lot of money. And I grew up always, as I was growing up, we were paying down a doctor visit or a hospital stay. My entire childhood. I didn't get health coverage until I was 24 years old and got a job that actually provided health coverage. And so I think health care should be a basic right. For people like you, like me, like my hard-working parents, working in the coal mines and the factories to provide energy for this country, working to provide clothing that got sold all across. My parents worked hard. And I always wondered, why is it? Are we bad people? No. The government provides public safety. We provide oversight and funding for education. We make sure that basic things are provided to our citizenry, and we pay for it. Yes. Those undocumented individuals pay taxes. Yes. They should have access to decent, quality, basic health care. And so when I moved across the country to California, I had a California dream. And I knew that this was the land of opportunity, and California has been incredibly good to me. I want everybody to have the opportunities that I've had in California, and that includes health coverage. California's done some incredible things. We have wonderful values here in this state. And our values mean that we want to provide for all of our residents. All of our residents. We want to make sure that we're doing the best we can. And a leader like Ricardo Lara has pushed from the day he got here to expand health care for everyone. And I applaud him for that. And so what we have to do, you know, California took a huge step forward when we embraced the Affordable Care Act. And what people need to understand, the basic principle of the Affordable Care Act was universality of care and coverage for everyone. Yes. So we moved the dialogue forward, and now we're ready to take the next step. Because it should not matter who is in the White House. Our benefits should not change year to year. We worked hard to move this dialogue forward. We've got 5 million additional people covered in California through Covered California and Medi-Cal expansion. We can do better. And our fate will not rest in the hands of someone who prefers to reduce costs on our backs, take away coverage. We have had a vision of possible, of what is possible. We know what we can do. We can take the next steps. We can work together. It won't be easy.
But we can do it.
But we can do it.
You know, now more than ever, we're at a crossroads when it comes to healthcare delivery systems. We see Trump administration is going to move to dismantle the Affordable Care Act. And so we need to have an alternative. We need to make sure that, you know, we protect our American constitutional values that says that healthcare is a human right. So in California, we have to lead. Now more than ever, it's important. So we're working on different modeling. We know that depending on what the federal government does, we're going to get less money. And so we're trying to figure out what that model looks like. So we're going to have a a solid financing plan once we figure out what President Trump's going to do. Thank you.